We decided to make a movie about one of the most frustrating problems in healthcare today. It causes people to lose a lot of time from their lives. We decided to tell the story of migraine. The story of an illness is told by telling the people's stories, the people who have the illness, about their frustrations, their pain, and their hope. We were lucky to have the help of real people with headaches. And these volunteers represented the many people who had a poor quality of life because of their migraines and cluster headaches. People in these interviews learned to be their own advocates, and they were eventually able to find help. This is a story of hope. We decided to tell the story of Jennifer Niehaus. She's a composite of thousands of people, perhaps many of whom I've treated. Our viewers might see themselves in Jennifer, or they might be reminded of a spouse, a friend, a coworker, a sister. Many people with migraine will lose substantial parts of their lives because of pain and nausea.
Yeah, come on.
It doesn't affect my making plans so much as it does keeping plans. You know, I still make plans a lot, but in the back of my head it's like, well, I don't know for sure if I'm going to be able to make it.
Come on, wake up.
It affects my work by, there's usually at least a day a month when I really don't feel well enough to go into work. There are other times that I would like to stay home, but I just don't have enough sick time, so I usually...
When I was working full-time before my children were born, I missed a lot more work than I would miss a day or two every couple of weeks.
And it makes you feel so inadequate. It makes you feel like you can't do the things that you really need to do. And I'm constantly apologizing for myself, and I just wonder what they think of that.
Well, my kid and my husband, absolutely. The people that are closest to me. You know, mommy has to be on top of things.
People get desperate for relief, and in fact they go frantically to the stores and buy large amounts of over-the-counter medications, and they overuse them. Basically, if you take an analgesic too often, you will end up with more and more headaches. Even the simplest medications can cause overuse problems. They can be any kind of painkiller. They can cause liver damage, kidney damage, ulcers, and other such problems. But before that happens, usually we're ending up with more and more headaches. They were not meant for excessive use. Migraine is quite hereditary. It's not unusual to see entire families with migraine. Many people can look back and recall their parent having the headaches or lying on a couch in a dark room.
My father had migraines.
And then our dad had migraines, and then also his sister definitely had them.
I didn't have the education. I didn't know that having a headache every day was atypical. I didn't know that the nausea, the vomiting, or bright lights, or the smells, I didn't know that that could be a migraine. People tell you that headaches, migraine headaches, are on one side of your head. That's not necessarily true. Some people have them on both sides of their head.
A lot of people lose time from their lives, especially parents who want to spend time with their kids. The kids accept it. The kids know the parent is down with a headache.
I do miss out on a lot of time with them because they have headaches, and they're really getting used to me having to lay down and put ice on my head and stuff like that, and it's a drag, you know, really. I'd rather be doing fun stuff with them.
There's been a few mornings where I've had to call in and come in late because I wake up with a headache. I take some medication and go back to sleep for a couple of hours and then come in.
When a person has an existing headache and they try to get to work, they will try to avoid sound or light.
Lights, fluorescent lights especially.
Again, we will not be turning the lights on today, and there will be no yelling or anybody doing anything loud.
Sometimes a whiff of perfume in the midst of a headache can send a person off to become very sick to their stomach.
Sudden changes in the weather will bring them on.
Sounds. If I have a headache starting and it's hot, that makes it worse.
Mine's menstrual. That's what I feel mine is. Sometimes I get, with stress at work.
One of my triggers is to be off of a sleep-wake cycle. So sleeping in an hour too much for me will trigger a migraine within 30 to 60 minutes.
Stress is one, but one of the really, really big ones for me is weather changes, especially low pressure fronts.
A lot of people think that when weather causes headaches to get worse or to begin, that it's because of their sinuses. In reality, the brain is very responsive to barometric changes, and the events that occur just before a storm or a weather change can easily provoke headaches in many migraine people. Unfortunately, this leads to unnecessary allergy testing or the purchase of lots of allergy medications, but actually it's what the migraine person commonly experiences when there's a weather change.
Holden was actually coming to grips with the world around.
Dancing wherever we are, I get a headache, and I get one that's debilitating where I'm nauseated, and my nausea is what makes the headaches the worst.
Oh, Jennifer, if you've got a moment.
Symptoms I would get would be severe pain and vomiting. I mean, I would actually get physically sick, which totally debilitates you.
I was getting ready to go to church, and I just, I just threw up everywhere. I mean, I was feeling really horrible.
For some reason, we always had a house with a bathroom right next to the bedroom because that's where I would spend the whole day.
Bosses are not often sympathetic about absenteeism, especially if they've not had any severe headaches themselves. Usually it's the absenteeism that leads to discharge from the jobs.
I walked by and some of the boys were jumping up and down, so I came in and quieted them down.
Yeah, I'm sorry about that. I don't feel very well today.
In other situations, they actually accuse the person of being on mind-altering drugs, painkillers, street drugs, and such.
When a headache would start, if you were at work, yeah, it reduce your effectiveness because you're done. you can't do anything.
I noticed in medical school, especially when I was academically, cognitively challenged, that my thinking process would be slowed. My speech could be even slurred, especially if I had had sleep deprivation. I became confused. I had mood swings, and they became so bad with the sleep deprivation that I thought I was having a stroke.
Nauseous, sometimes dizzy. I've had hard times trying to find words. I feel a little fuzzy and, not quite as all there mentally when I'm having a really bad headache.
Until the medicine kicks in, the fuzzy brain, you just don't really feel like using your brain to do anything.
When people are having headaches, if they don't miss work, they're at work, but they're not productive. They will avoid meetings, they will avoid bright lights, they'll avoid most anything. Important decisions are often not made because the person doesn't feel right. Well-meaning friends or workmates will often have suggestions, although impractical sometimes, in their response to the headache person.
Maybe if you weren't so dark all the time.
People often don't understand when a person with bad headache or migraine especially will tell their friend about their headaches. The other person thinks about what their own headaches feel like, which might be a low-grade tension headache, which we all can get. They have no idea what that person is going through. And as a result, they don't really understand how much this individual might be suffering.
I remember being sick a lot in high school. My mom and dad, of course, thought maybe I was a hypochondriac. I was overly sensitive to symptoms.
I have felt like family members and friends didn't really take me seriously because it just sounds so crazy to say, you know, I've had a headache every day for the last 14 years. And sometimes I ask myself that, how do I function?
The frustration is that these people don't think they're being taken seriously. It could be friends or relatives or even their physician.
I said, you know, doctor, I said, I get these headaches and they're really, really bad and I think maybe I get migraines. And he goes, really? He goes, oh, your poor husband. And he goes, well, my dear, tell you what, you need to get a hobby. Your husband shouldn't be coming home watching after these kids.
Doctor's office.
Hi, this is Jennifer Niehaus. I need to see Dr. Thomas today.
Do you have an appointment?
No, but the meds he suggested aren't working. I can barely walk.
If you don't have an appointment, I don't know what I can...
Look, anything today is fine. I can't function. I really need to get in and see him.
Here he is. Hold on one moment.
I remember after missing, 40 plus days of school as a freshman in high school that I finally saw my pediatrician at that point, and he didn't know what to do. And then as I grew up, and then I actually did see an internist, and this was probably 4 or 5 years before I started medical school, he didn't really know how to manage headaches that were this severe, this disabling, and this frequent.
Almost all of the primary care physicians that I have seen, or OBGYNs, I've always commented that I have headaches, and they just seem to go and move right along.
And sometimes my headaches would last 4 whole days. People just don't understand that you would have 4 lousy days of headaches. You were in the bathroom for 4 days throwing up.
Some patients get quite frustrated with their physicians, especially when it seems like the physician is not aware of how to treat headaches or even care about treating headaches. Sometimes it's the patient's perception, even though the physician may be well-meaning.
Jennifer, what's wrong?
Nothing. Leave me alone.
I was down, I was in bed, I was depressed. I couldn't get any relief from anything. I'd gone to my regular medical doctor. He wasn't helping at all. He kept saying, oh, it's just a bad headache, it's just a bad headache, and, take over-the-counter medications, and nothing was working.
I had a headache so bad, and I was in my apartment. I thought that I was going to die, and so I opened the door of my apartment so that if I died or something, somebody would know, they would say, something's wrong, let's go.
People are quite frightened by their migraines, especially when they haven't been evaluated or not for a long time. Many people are afraid they have brain tumors or some other serious condition because it's painful.
I think that a lot of the doctors just felt totally overwhelmed by it, which is how I feel by it as well.
I think it is really important, if the person has headaches, to sit down with their doctor and be sure they take the time and ask the questions, tell the doctor what's going on, and express their fears and their pain and come up with a solution. The solution might be a medication, it might be a referral to another center, but the person needs to be sure they're taken seriously.
First, it was my pediatrician that really worked with it, and it got to a point where he just didn't really know what to do with it. It really wasn't his field of training.
Jennifer, what's wrong?
Nothing.
Are you all right?
I have class 6th period, and I have a doctor's appointment at 1.
Your free period is 7th? Mine is 6th. I'll cover for you.
Really?
A person who's suffering this much will often benefit from support from those that are closest to them.
Yeah, friends and family would ask about headaches, and some friends and family are very sympathetic about it. But obviously, some people don't quite understand the level or care to understand.
My professors were fairly supportive. I had one that, but you always have that kind of challenge.
I've never gone to a professor and said, I missed your class because I had a migraine. I would just say I was generally ill and leave it at that.
We're just as frustrated, if not more, and we're the ones suffering from the headache. So support from family and friends is so important. It's a very real thing.
Jen?
Hey,
I just walked out of Dr. Thomas's office, and they said I have another sinus headache, and that aspirin should take care of it.
That's what they always told Mom.
I know.
When my headaches get really bad, I always have pain in my forehead and behind my eyes, in my sinus area, and then I get some neck pain.
The weather affected them. I assumed they were sinuses. So, you know, I was on every kind of sinus medication you can think of. None of them did much good until the third or fourth day when it went away anyways.
Some people go for decades without knowing that the symptoms they have are migraine. They often think it's some other condition.
It wasn't until about 6 months ago that they were actually diagnosed as migraines. So for 35 years, I just thought I had a lot of sinus headaches.
At some point you have to wonder, how can something go for so long and be so painful for so many years? And it's because of misunderstanding. There are 3 simple questions that can be asked to uncover the majority of migraine. Certainly there are more questions a physician is going to ask about headaches, but these 3 questions are a good beginning.
They were playing with their dolls, and my older daughter said, "Oh, I'm sorry, but I can't play with you right now because I have a headache." And she laid down on her bed, and she took a washcloth, and she put it and was laying, and I was like, oh my goodness.
How's your head?
Look, I need you to take me to the ER. The babysitter's coming to watch Sarah. She'll be here any minute.
Well, I've had many times where, unfortunately, my husband has had to miss work. Not only have I had to miss work, but if I've been sick enough because of the kids, my husband has had to call in. And so now it's not only a matter of me missing time with my kids, but my husband's had to call in, and I often wonder to myself, do they believe what he's telling them, because now he's missing time.
My husband ended up taking me to ER.
A couple of times the headaches got so bad that I had my husband take me into the ER.
Emergency rooms will prioritize or triage cases based upon how severe or serious they perceive the person to be. This often leads to headache patients waiting.
Jennifer Niehaus. Hi, looks like we're ready for you today. If you'd like to follow me, I'll take your paperwork. Okay, right this way.
Going to the emergency room, waiting evaluation, waiting treatment can be frustrating and frightening for the patient who has the headache. They have mixed feelings, which can also include isolation, waiting for relief, and hoping to be taken seriously.
Yeah, it's bad. It's pretty bad. I've got to get down there as soon as I finish up in here. What's going on in here?
Her name is Jennifer Niehaus, and she says...
Oh, Jennifer, look, I've got to run down the other side. Just give her some aspirin, tell her to get some sleep, and let's get her out of here. We need this room.
I didn't want to, question this guy. I figure he's the doctor. He must know what he's doing, but it didn't help at all. And I was in the emergency room for 4 hours, and all it did was make me really sleepy. I fell asleep, and I woke up, and the pain was still there, and so I just went home.
They gave me some type of a shot, and I don't know what it was, but it did nothing, did not touch the pain at all. And then they told him to take me home.
He is capable of caring. Okay. Moving on. Get out your books. Let's look at question 9.
Come in, Jennifer.
Hi.
Have a seat, please. How are you feeling?
Fine. I'm good. Things went well today. My head doesn't hurt.
Look, Jennifer, might as well get right to the point. We've arranged for a permanent sub to fill in for you while you take an indefinite medical leave of absence.
Things went better today. I really think...
We just feel that we need to wait for you to get yourself under control before depending on you to teach every day.
There were a number of times, I think three times when I had to take a leave of absence. One of them was around 5 or 6 months in duration because I just couldn't get the headaches under control.
Jamie? Yeah, what's wrong? I lost my job.
In school, I actually had to take a leave during, let's see, it was my second year in the PhD program, and I couldn't finish.
Doctor's office.
Hi, this is Jennifer Niehaus. I need a referral to Dr. Bailey.
One moment. I'll see if Dr. Thomas is available. Jennifer?
Yes.
Did you try what Dr. Thomas told you to do?
He just told me to take some over-the-counter meds.
And did you take the specific ones he told you to take?
No, I've taken them before. They don't work.
But if you don't do what he...
Look, I don't think you understand. I will kill myself. Do you get me? I will put a gun to my head. I will pull the trigger.
Hold one moment.
And at that point, we realized that we needed to get further medical help.
And last month I had 2 days where I didn't have a headache at all, and that's really rare for me, so I'm feeling pretty hopeful.
If you find a good doctor, make sure that you got the kind of insurance that you can get the kind of services you need.
The message of this movie is that people don't need to suffer so much. They need to be their own advocates. They need to ask for help.
I think that the basic point is you know your body better than anybody. And if you're not feeling good about your health and whatever is wrong, headaches, it doesn't matter what it is, if it's affecting your ability to function as a human being, either as a stay-at-home mom, as a working mom, as a single person, maybe you don't even have a full-time job, but if you cannot function as well as you'd like on a daily basis, then something is wrong. And if you go to see a physician and that physician doesn't appear to understand, doesn't make the referral that you would like, I think you need to investigate it yourself. With headaches, having a daily headache is not okay. And getting that referral to see an individual that can treat headaches appropriately, I think is very crucial. Don't wait 10, 15 years like I did to get the appropriate diagnosis. I wish that during that time that I could get some of my life back.